So one of the things, too, that I appreciate about you, because Iowans, Americans are dealing with this, and it's a topic that really hasn't been covered a lot, and that's health care. And you've made it as one of your top priorities in your campaign.
Absolutely.
Can you talk a little bit about that and how we would start to address health care costs and how?
Absolutely. So this is something, so we just launched this week, a 7-year economic rescue plan. So we can talk about that later. Budget-wise, how are we really going to do this economically? Because we've been on a path spending 25% more than we bring in for decades. So I don't know that we can do that without transforming healthcare, though. So healthcare is 35% of our budget, completely broken. When you start looking at healthcare, this is the way I see it. I'm looking at it analytically. We have 40% higher inflation than regular inflation in healthcare for 20 years. So look at all the big things that's changing. And then you start looking at the business side of it. It's really a segment of 3 major groups of monopolies that have to be broken up. Otherwise, we'll never have the healthcare that we're supposed to have. So it's really, my campaign is about actually desocializing healthcare. And this is what I'm telling America. We were so afraid of the ACA, Affordable Care Act, that it was going to socialize medicine. Remember how afraid we were that we didn't want that single-payer system. We can't have that no matter what. We've already socialized health care because it's the only thing that we purchase as Americans today where we no longer ask this one question, like, how much does it cost for me to be here today? They just say, give me your card. And if you did ask, they wouldn't be able to tell us. So we've got to bring price visibility. We don't buy tractors this way, cars this way, houses this way, food this way, but we buy health care this way. We trust the insurance company, pray they negotiated for us. And I'll just say this, it's insanity. We can't keep doing it. So we have too few players in insurance exchanges. We need to get rid of the old law that doesn't allow insurance companies to compete across state lines. I think you have 3 or 4 major insurance carriers here. I have over 6,000 competitors in the mergers and acquisition business in the United States. Thousands. Competition makes things competitive. Competition makes prices go down. And we need to see doctors. So when we go in, we have to put, doctors are owned by hospitals now. 30 years ago, I used to work for Boston Scientific, and we used to sell to doctors. Now 75% of doctors work for hospitals. And then lastly is Big Pharma. So Big Pharma is eating away and we spend 2.5 times as much in pharmaceutical drugs. But the reason is because we give patent extensions longer than anybody else in Europe or any other developed nation. So we have to, they put patent hedges around. It's a monopoly too, so we have to fix that. And when we do, everything's going to change. Everything's going to change. Think of the Uberization of healthcare. What's it going to be like when you can go to your doctor, see what that costs, and put the patient back in charge? Because when you do, you'll start treating like your car insurance. If you don't like your car insurance today, what do? You
go get another
You go
quote.
get a new one. How long does it take? Like an hour. But if you don't like your health insurance, what do? You cry. You just you call HR and you complain. But that's all you can do because you're stuck. So we have a plan to fix this.
Transparency, it needs to be addressed.
Have to.